So that's basically what it is. We have 2 more chapters to go, and that is it. We're gonna be done. And we're gonna go on vacation, remember, until February. So that's basically how it works. So good. Do you guys have any questions up to now? Okay. So let's start this chapter once again. It's not something that you guys are familiar with unless you have a military person in your family. Other than that, you're not gonna be familiar with some of the terms that we're gonna use. It's part of the curriculum, it's part of the chapters, so it's part of this module. Um, Maybe one question, maybe not sure, will show up on your exam. But it's a good thing that you understand because this insurance usually, um, you're not going to encounter this insurance in your office because this is for the military personnel, so or their families, and they have hospitals and institutions or that that they're going to go see because that's part of the network. Regular doctors' offices and hospitals usually are not the place for the military. They have their own hospitals, they have their own institutions where they go. But it is a good thing that you have an idea that there is uh, an insurance for military personnel. I'm not talking about just military, but for the veterans, for the retirees, family members of active duty, veterans, retirees. So again, very interesting. It's very interesting to know this. So once again, we're going to talk about TRICARE and CHOPNA. We're going to see what is the difference between TRICARE and CHOPNA. Which services will be covered by TRICARE, which services will be covered by CHOPNA. Think about TRICARE and CHOPNA as Medicare and Medicaid. One is for people older than 65. The other ones for the ones that have low income. Now, in the military, it's not like that, but it's similar. So we're going to see later on what is the difference between them. Which type of military personnel receives TRICARE? Which ones qualifies for CHOPNA? So that's basically what it is. There is a process, of course, every single insurance is going to have a cycle, meaning from the moment that we start seeing the patient to the time that we get reimbursed for those services. How do we collect the money for the military? Now, once again, it's a lot easier this part because this is paid by the government. That being said, I'm just going to recap. Whatever it is private, whatever it is the government. So if you have, the knowledge of, or the difference between these type of insurances, that's going to give you answers to many questions, not necessarily during your exam. Because fortunately for your exam, national certification, there are not many questions from insurance. They are related because they have to do with medical records. That's a different issue, remember. So we need to know certain terms from insurance that we don't see then within medical records. Because remember, for medical records, we need to remember about HIPAA privacy rule, security rule, confidential rule, because those are the major points for keeping the patients private, remember. So that's the most important thing. So we're going to be talking about ethics. Why ethics? Because we have to treat the patients in certain way. We should not ignore the patient complaints. We should not ignore the patients not attending the office, because then, remember, we are going to be accused not directly for abandonment or for negligence, but for other things. So we're gonna make sure that those topics, those points, meaning HIPAA, and some of the ethical issues in medical, we have to consider that a lot because they are part of your national certification. This part of insurance is because it's needed for you, particularly because you need to know the type of insurances, how to deal with these insurances when the patient comes to your office, how to verify patient's eligibility. I've said this so many times because this is actually what is more important about these chapters or this module in general. To familiarize yourself with all these types of insurances. At least you heard about them and you're going to be doing the, making the difference or the discrimination in between which are considered private or, the employer sponsored, or if you get your own health insurance through a private, from a private health insurance, or whether you get it through the government just because you work for more than 10 years. So then after 65, you qualify for Medicare. Or if your income is not enough to pay for medical services, then you're going to get Medicaid. So these are the things that you need to know, the rule, the general rule. And then we enter into the military insurances. Because remember, military people, there are many military personnel enrolled in all these insurances. But they don't have these regular, they have the government, they can qualify for Medicare, not Medicaid, but Medicare, yes. But they have other types of options within this TRICARE and the CHAPNA. So something that I want to clarify to you is that, just make sure that you do understand the types of insurances out there and who sponsors them. So this is part of the government. So Medicare, Medicaid, TRICARE, and CHAPNA, these are government or governmental insurances. It is funded by the government. Any other organization, it is considered private. Even though if they sometimes partner with the government to render services like United Healthcare, Blue Cross Blue Shield. They have HMOs, this health maintenance organization. That's a different issue. These are still private. They are not government. So if you have an insurance that is a Medicaid, but it's through United Healthcare or Blue Cross Blue Shield, that doesn't mean that, oh, this is paid by the government. No, they're still private. Remember, only Medicaid, Medicare, and TRICARE and CHAPNA, the only governmental insurance companies. Everything else private. It's just that some of the private, they render services paid by the government, but they are not government institutions. So that's basically what it is. Because this was not like that before. Remember, before, Medicaid was just plain Medicaid. They didn't have Fidelis, they didn't have MetroPlus or Health First. None of those. Those are not something that it was before. So that was created. Remember, these HMOs that were created. Because as I mentioned before, remember, at the beginning of these chapters, these HMOs were created for, to kind of deal with cost and abuse from the part of the medical doctors and the patients. So those things are the ones that I want you to remember. And most importantly, getting familiar with these insurances. Here, we're going to talk about again some of, the processes that you go through when a patient comes into the office. What is it you have to do? Well, this is a patient that is using an insurance card. So we have to see the card. We have to make sure that this patient is eligible, that has coverage. Now, this is not as restricted as the private ones because this is paid by the government. But again, it's not as restricted as Medicaid. This has a little more leeway, but still it's going to be limited. So we're going to start with this TRICARE first. So we're going to talk about the eligibility requirements for TRICARE. Who qualifies? Yeah, we're talking about the military, right? So which branches of the military are going to be participating? And what type of personnel that it is within these branches of the military are going to be the participants. So it's not like anyone who is in the military is going to be using TRICARE. No, remember, not everyone is going to be using Medicare. It's not everyone going to be using Medicare. You have to have some type of, requirements in order for you to be part of it, to qualify. So that's basically how it works. Now, within this TRICARE, we're also going to have medical doctors that are participating providers for TRICARE. And also, we're going to have those non-participating providers. Remember, this is just people like us. They just were enrolled in the military. That's basic. That's the only difference. And that's what they qualify for other insurance than civilians don't do, because we are civilians. Every single person that comes to the hospital, they are civilians. They don't work by, the government or the military. For that reason, they have different insurances. And they have different choices, options. So we're going to see that type of options that TRICARE has. For instance, they have Prime, they have Selected or Select TRICARE. So we're going to see, okay, so who qualifies for them? How do you enroll in this type of insurances? Now, just for you to understand the difference. You never know where you're going to end up working. You might end up working at the VA hospital, the Veterans Hospital. There is one very famous in downtown, well, kind of downtown. Probably you heard about it. So who knows where you're going to end up working? So you're going to be familiar with this type of insurances. So that's how it works. And they can go out of the network, just like civilians do. You have an insurance, but they don't cover for these services, or they don't have a provider that provides these particular services. So you have to look for the medical provider that is going to render the services that you need. So you need to go out of network. So that's basically what it is. But remember, not every single professional within your network might, have the qualifications for certain conditions, certain treatments. So you might have to go out of the network to get those services. And that's why these medical insurances or insurance companies, I might say, have different ways of giving you the options. So that's basically how it works. So it's very important that we kind of understand what's going on. I think that oh yeah. So we're gonna discuss again what is CHAPNA, what is CHAMBA, or what is the requirements for eligibility. Remember, TRICARE, we're gonna see the same thing. And how they're gonna prepare those claims for them. So that's basically what it is. Gonna go a little bit easy on this so you can understand, even though if probably you're not gonna need it on the long run. So here we have the Civilian Health and Medical Program of the Uniformed Services. This is CHAMPUS. This was the former name. This was the way that we used to call TRICARE. They removed the name. It's not called CHAMPUS anymore. Now we call it TRICARE program. Later on, we're gonna understand. Now, TRICARE do not have, this is not an acronym per se. Oh, T stands for, R stands for, I stands, no. Tri means three. So there is three options that are going to be offered for the military personnel. So different categories of insurance. They are classified depending on, what is the status of this military. Are they active duty, or it is for the family, for the dependents, or it is for veterans or retirees? Who qualifies? Well, we're going to see that, because that's basically what it is. So in general, TRICARE, remember, is the insurance for military personnel and their families. But that is CHAMBA as well. But what is the difference? We're going to see that some of these insurances are going to be exclusively for the active duty, meaning the ones that are still on the job and their families. Others are going to be for those veterans, those who have already retired, and those who have fought in the war and they are disabled. they no longer can work. So again, this is like, people who retires from a regular job. You're gonna get Medicare, right? Well, they're gonna get Shamba. So that's basically what it is. So that's the difference between these two very large military health insurance. So it says right there that TRICARE is a government health program serving dependents of active duty service members. Remember, TRICARE is for the active duty, for those who are still working, they're still on the job. So those are the things that we need to understand. Who else qualifies for this TRICARE? Their family members. If they are in active duty, well, their family members are also covered. They're still working, right? So that is also true. Military retirees and their family members, whether, the family member passed away, the family member still gets covered because you serve in the military. So that's basically what it is. So when a family member from someone who has TRICARE passes away, the spouse, the dependents that they left behind, they will not lose the insurance. They will keep the insurance until they die. So that's basically how it is. And once again, there are many, many people enrolled in the military. And when we talk about military, we're not talking about just males. There are females also enrolled in the military. So there are many professionals that are enrolled in the military. So there are counters. Not every single accountant is an officer, is a soldier, is a lieutenant, is a captain. No, they have civilians also working for the military. And if they work for the military, they're going to have some type of insurance with the military as well. So they receive TRICARE. So let's say that you have a family member in the military. Well, you as a dependent, if that person is your spouse or your father or your mother, you're going to be covered by TRICARE. But if you work independently, you're not a military person, but you're working for them, you're going to qualify for TRICARE as well. So if something happens, you're going to be seen within the military hospital. We have military hospitals. We don't see them. They are not spread around like the private restaurants, public restaurants, hospitals, or private. No, they are located directly where they have a base for this military personnel, whether the Marines, whether it's the Air Force, whether it is the Army, the Coast Guards, all of these personnel, they have a base. And right there, when they have a base, they're gonna have a military hospital. And some of the doctors that works there, they are not military. They are not serving as military. They are serving as medical doctors. That they receive services from TRICARE because they work for the government. So that's basically what it is. And some of these medical doctors, sometimes they join the military. And if you are professional, if you're a medical doctor, you will receive the title of lieutenant. And as time goes by, with seniority, then you can be promoted to captain. But you're not a military person. So that's how it works. So that will be TRICARE. Not long ago, they were asking, TRICARE was known before shampoos. They don't ask these questions anymore. Now it's TRICARE. What is the name of the insurance that covers military, active duty military personnel and their families? TRICARE. So that's what I want you to remember. Anything else is just telling you the story and who qualifies. Sometimes says, oh, only people who is actually, enroll with the military, the ones that qualifies. No, it can be civilians that are working for the military person. Because you're not going to go get services somewhere else. They get it through the services that they have there. So that's how it works. So let's talk about this TRICARE eligibility. Who qualifies? Well, we have all these branches of the military. Remember, the Army, Navy, Air Force, the Marines, the Coast Guards, and public health services. See, these are the ones that we're talking about that belongs to the government. They can be seen in the military hospital. Most of the people sometimes that is seen over there, it's not actually the military. There are people that works with the government as well. Military hospitals are very, very complex. They have state-of-the-art equipment because they need to protect, their military personnel. If something happens, they need to put them back on track the fastest way possible because they need them, to protect us. So that's basically what it is. So there are many other organizations that, are part of the government that also receive these services. Like, for instance, the National Oceanic and Atmospheric Administration. Remember, this is the US government agency that monitors and predicts the state of the environment, like the weather. See, now that they are talking about weather changes and things like that, well, we have personal, like scientists working on that, making sure that they know how the weather is going to be, particularly for, the Marines, the ones that are the Coast Guards, that these people that are out there in the ocean, covering and protecting, the country. So that's basically what it is. So even though if you are in the reserves for any of the branches, you're still gonna be covered. You qualify for TRICARE. So whenever we need to find out whether someone is covered by TRICARE or CHAPNA, we're going to go to the Defense Enrollment Eligibility Report System or the DEERS, which is the acronym. So that's basically what it is. So this is like when we go to the online, or when you go to your database, your hospital information system. You're gonna have all the people who are, enrolled in this particular hospital, in this particular institution. Well, we're not gonna be seeing the military because they have their own database. Well, we can find them and see if they are enrolled. So whenever the patient comes to the office, they just enter in this particular, database application to find out whether they're eligible or they have coverage or not. Because things change when this active duty personnel, they completed the time that they were enrolled for in any of these branches of the military services, the status of the insurance changes. They're going to get another insurance because it's for veterans or retirees. So that's basically what it is. It depends on the reason why they were discharged. Remember that these people sign up for certain periods of time. You do not join the military forever. Yeah, some people make a career out of the military. That's all they want. But you can go there just for a few years, 3, 4 years. That's it. You sign up for that. And then you go back to the civilian world. Now you are a veteran because you work for them. But you're not a retiree because you didn't meet all the requirements. You didn't work long enough. So that's basically what it is. So then you're going to be qualifying for some type of insurance within the military. And now if you're going to work in civilian work doing something else, now you're going to have private insurance or employers is, sponsor insurance plus TRICARE. So that's how it works. It's not difficult. It's just for you to understand. So the uniformed services members are referred as sponsors. So instead we calling them policyholders, they are sponsors. For what reason? Because they receive insurance, health insurance through TRICARE or CHAMBA, but they also give insurance to the members of the family. So that's basically what it is. So instead of calling them dependents, which is the right word, right? Because that would say in the civilian world, see, if I work and I have insurance, my sons are my dependents. That's basically what it is. Here, then we're not going to call them policyholders. We're going to call them sponsors. So that's basically what it is. Because it's a different way of, categorizing the military personnel. Now, do not worry, this will not be asked on your exam. If you ever have a question in your exam, it's going to be, okay, who is covered by TRICARE? Or either or, they're gonna ask you, TRICARE covers which type of personnel? Military personnel, remember, active duty and the families. Or this is the insurance that covers military personnel. Which one is it? Then you have to respond TRICARE. So remember, you're always going to have like both ways. They're going to give you, you know, a little statement about who is that is covered, and then you have to see by who, about which organization. It's like when you're going to be asked about Medicaid. This insurance covers low income. Then you're going to look for Medicaid. This insurance covers 65 and older people. Oh, you got to look for Medicare. This insurance covers military personnel, just in general. If it is military, you're not going to pick Medicare or Medicaid or any other private. You're going to set TRICARE. So that's basically the major point for covering this chapter. So it says right there that TRICARE beneficiaries fall into one or two groups, Group A and Group B. Now, this all depends on which time of the year you enlisted. Remember, enlisting is like, when you sign up to join the military. For us as civilians, is the date that you register with your doctor. For the military is the time when you enlisted. Oh, I'm going to the Navy, I'm going to the Army, I'm going to the Air Force. Oh, I joined the Coast Guards. Oh yeah, when you going? This day. So if you belong to the Group A, are all these military personnel that enlisted, sponsors that enlisted or were appointed before January 1st, 2018. So anyone who were enlisted before January 2018, they belong to the Group A. What about Group B? Well, anyone else who joined after January 1st, 2018, they belong to the Group B. So be careful, do not confuse Group A and Group B for Medicare Part A or Part B, because that's not what it's trying to explain here. Now, once again, this will not be asked in your exam. So for that reason, it's just for you not to confuse it. It has nothing to do Group A and Group B. Because remember, Medicare Part A is for covered services for hospitalization. Medicare Part B covers services for outpatients services. So don't think that we are talking about the same. So these are groups, not parts. Now, Part A, Part B, Part C, and Part D. That's another thing. Yes, you need to know it for exams, because usually these questions comes once in a while. They might throw one of the questions right there, and you need to know. Again, that is very important. These groups, no worries. So again, whether these people pays more or less, whether they were, enlisted prior to January 2018 or after January 2018, no, all depends what plan they have, because we're going to talk about the plans that they can join. the options that they have. It's like when you buy your own medical insurance, what plan is it? What covers? One of the good things about the military is that almost cover every single services. Again, when you are a retiree, when you're a veteran, some of the services might not be covered. So then you have to pay for them out of your pocket. A lower cost, yeah, because you were in the military, but still, then you have to pay for it. So that's how it works. So let's talk about these providers that participate with TRICARE and those providers that do not participate with TRICARE. So think about the insurance, the commercial insurance, so the private insurance. If you do not participate, you are not part of the network, meaning I'm the medical doctor, I did not sign up for TRICARE. But one of the clients wants to come to see my office and render services to them, then, certain, qualifications are needed. And you have to follow certain policies when it comes to the amount of charges that you're gonna get, because I'm not participating with TRICARE. So therefore, I can charge more for the services. So here is where, once again, if you take someone out of the network, then TRICARE is gonna pay, but it's not gonna pay more, of they have a baseline. Let's put it that way. So they have some allowable charge. Okay, so if it is someone out of the network, we can go up to this much. They have limitations, remember. And if you accept that, assignment, then the doctor has to decide whether they're gonna accept the money that TRICARE is paying for the services, then you provide the services. If you don't, then don't provide the services because they're not gonna pay you more. Now, if you are participating provider, so then these payments are paid directly to TRICARE, and TRICARE, remember, is going to pay the hospital. But if you are a non-participating provider, then TRICARE is going to send the money to the patient, and the patient needs to pay the provider. Remember, that's the way it used to be with insurances. That the insurance company deal directly with the patient, not with the provider. So the insurance was sending the money to the patient, and the patient now pay the medical provider. But there was a problem with that, particularly with the civilians. Because when the patient received that money, they have it in their hands and they receive the services, they didn't want to pay the provider. They spend the money on something else. No, the money was supposed to be going to you, but you supposed to pay. To solve the problem, the insurance companies is going to say, well, you know what? I'm having troubles right here. So we're not going to pay you, patient, the money. We're not going to send the money to you. We're going to send you the explanation of benefits. That's it. That's the statement saying what was provided to you. But then actually the money, we're going to send it to your provider because it's the one to provide the services to you. So that's basically what it is. Well, with the military, it's the same. If you use a medical provider, whether it's a medical provider, a hospital that does not participate with TRICARE, then once again, that insurance send the money to the patient, and the patient has to reimburse the medical doctor, because the medical doctor is going to send the bill to the patient. So that's how it works. I don't know if that's going to change, but this is how it is right now with the military. Remember, it was like that for the civilians. Because now we're talking about military personally, now we're talking about civilians. Civilians are us, we're not military people. So that's basically how it works. So participating, non-participating providers. Yes, military people can see someone who is not participating with TRICARE. But then, once again, they have to assume, if there is some out-of-pocket money, they have to pay it. Because once again, TRICARE is going to send the money to the patient, but if that's not the amount allowable, then they have to come out with the rest of the money for the medical provider. Because remember, they're going to ask you to sign this advice, this benefit advice, remember. So they have to. That's how it works. Insurances do not lose anything. They are covered. They don't want to have any issues. That's what you have to sign. The acceptance of the acceptance of assignment with the medical provider. And in this case, the patients or the sponsors are going to sign another document that they're going to receive this money from the insurance, and they have to pay the medical doctor for the services provided. So that's how it works. So let's talk about these types of TRICARE insurance. So we have TRICARE Prime. So this TRICARE Prime, it works just like these HMOs, like Medicaid, because they're going to cover the active duty personnel only. Prime is for active duty, and it is families. That's it, and their families. That's how it works. So you're not gonna have like this type of strict restrictions when you require for certain services, but you do have some type of limitation, not as much as the HMOs from Medicaid, but they will have some type of restrictions. So that's basically what it is. So you're gonna have a medical provider, because an HMO means you're gonna have a medical provider. You're gonna have a kind of gatekeeper, remember, who is going to follow your medical conditions and who is the one who's going to order whether certain treatments, certain medications, or give you referrals to see another professional. So that's basically what it is. So this Prime, TRICARE Prime plan, let's put it that way, because this is a plan, you can receive it from any institution that takes this plan. Most of the time is from these military treatment facilities, MTF, which are the military hospital. You don't see soldiers or lieutenants, captains, or anyone else in a higher rank coming into a regular hospital to receive services. You don't. But if you work in the Veterans Hospital, you're going to see them. You're going to see them over there, not dressing as military because they are already veterans. They're already retirees or retired. So that's basically what it is. See, my father-in-law was a veteran from the Second World War II, something like that. And he was receiving services at the VA, the Veterans Hospital. So until he died. So that's basically what it is. Then my mother-in-law, which is right, my ex-wife, mother, she's still receiving services because he was in the military. He was in the World War II. So for that reason, get those services. But these are military hospitals. The VA is not a military, but it is based on all the, veterans and someone who went to the war. That's basically what it is. Someone who was disabled. And their dependents, remember. So military treatment facility is mostly a military hospital. They are located in a base when they have a military base. So that's how it works. What services are available with TRICARE? That's basically what this slide is all about. Available services vary by facility. And first priority is given to the service members on active duty. Well, of course, there is a priority for members of active duty because they have to go back to work, right? So they have to be taking care of them right away. But that is a large institution. So usually they have plenty of, availability to take care of the members of the family. But the members of the family most of the time are kind of, scheduled in advance. Military can be seen on regular basis when it's needed. You don't have to wait. So that's basically how it works. They don't have to pay a deductible. So that's basically what it is. No copayment. So that is good because they're working for the military, for the government. So most of the services are covered by the government directly. Now, the same goes for family members. So if you are an active duty, you're not going to pay none of these other fees that regularly civilians have to pay. Remember, when we talk about government, see, we don't pay that with Medicaid. Medicare requires differently, but we don't pay either because Medicare pays 80% of the total amount of the services. And the doctors sometimes just accept that. So they don't have to, start chasing the patients. Here, they don't have to do it either because the government is more flexible because the government has different regulations. If you have a private insurance and it's your own money, well, you're gonna be setting up, a fee for service for everything you do according to your specialty and where you're located. For the government insurances, it's a little different because this is money from the government, money from the taxpayer that is used. It's not somebody else's money, like in a private insurance company. That's a different issue. Yes, they have to control expenditures, right? You can't just, order anything that you want, even though if you don't need it, because then you're gonna run out of these funds, these resources. So what are you gonna do then? So that is the TRICARE Prime. So one of the things that, one of the take-home points from this um topic right now, TRICARE is, and TRICARE Prime particularly, it is that it covers active duty and their family members. They don't have to be responsible for co-payments, co-insurance, co-payments, any of those. The government pays for it. So that's how it works. Now, what is the prime service area? Because remember, we talk about right here, it says available within prime service areas and those who live within 800 miles of one of these primary care manager. So that's basically what it is. So what is the prime, the service? Prime service area, geographic areas designated to ensure medical readiness for active duty members. If you are stationary in this particular base, usually they have a military hospital. But if they don't have those services right there, or you were assigned to another place, then you can go to the nearest military hospital. You're a military, you can go to any of the hospitals within 100,000 miles distance. So you don't have to be exclusively seen or taken care of in that military hospitals in your base. If you don't want, if you want to go see someone else in a different hospital, as long as it is with this geographic, distance, then you're more than welcome. Because we have the military hospital, one of the best ones, Bethesda, Maryland. That is a very, very famous hospital. That's the place where if the president gets sick, that's what he will go if has to be hospitalized. All, these government, personnel that have high ranks and positions, that's what they will go. The same with these captains, colonels, and all of the above. They will go to the hospital. And the families, if they have a condition that only Bethesda Hospital has the personnel and the equipment, they will go there. That's how it works. So that is the prime service area. It is a location. It is one of these institutions, medical institution or hospital in certain areas where you're going to get the services, but it has to be with a certain distance. So the military treatment facilities, remember the military treatment facility most of the time, 99% of the time, is the military hospital within that particular base. See, when I'm talking about base, it's like if we have a army in this area where they are stationary, well, they're going to have a hospital right there for the army. They're going to have a hospital there where the Marines are stationary, where the Air Force is stationary, where the Coast Guards are stationary. Most of these bases usually have more than one branch. They can have the Navy, the Marines, or the Marines and the Army, or the Air Force and the Coast Guard. So it can be more than one of these military branches within the particular area that will benefit from that particular institution or military treatment facility, which is called. Let's talk about the catastrophic cap. So what it's actually telling you right here is that, military personnel, they have certain amount of money that, they can, after that limitation, they have to pay them out their pocket for certain services. So when there is a catastrophe or something, that was unforeseen, that is waived. You don't have to pay. So whether the military personnel, active duty, or the family members, they don't have to pay because they give you a certain amount of money for services during the particular year, because this is annually, this is per year. Think about Medicaid, because it's a lot easier to explain it this way. Medical coverage is done every 6 months. Well, that's what I learned the last time that I was familiar with that. I don't know if you have changed. Back in the days, it was every year that you have to renew your Medicare coverage, Medicaid. Now it's every 6 months. And during the 6 months, remember that I told you that they couldn't give you certain amount of doctor visits, certain amount of certain procedures, certain exams. They cover for certain medications. And the next year, things can change. But you have to renew it every year. For the military, it's like every year, every 6 months for the Medicaid. For the militaries, every year. So kind of you renew it, they give you a different cap. Okay, this year you're gonna get this much amount of money for services. It's not that they're gonna give you the money, it's going to be, at the military base where they are stationary. That's the contract that they have. So they're gonna have an insurance, they're gonna have a coverage for that particular year, depending of their rank, what the position these military personnel have. If you're a sergeant or if you are a lieutenant, you're not gonna get the same amount of money per year. Not talking about salary, I'm talking about coverage for insurance. Because a lieutenant have a higher rank. This is an officer. Whereas a sergeant is a sub officer, is under an officer. So they're gonna get a different amount of money that they're gonna receive. So that's basically what it is. So if there are some services that goes beyond what you're supposed, to be covered for, then without this particular catastrophic gap, they will have to pay it. If it is not a situation, a critical situation, then they have to pay out the pocket. But if it is a critical situation, then they will waive this cap. They will extend to the period of time that you need the services, because these are special particular situations. So that's basically how it is. We got to be sure that we do understand how this works. Just for, the sake of this course, not because you're going to be asked once again. It's just, for you to know it. Now we have the second plan, TRICARE Select. This is a fee-for-service health plan. Think about the PPO, preferred provider organization. When we were talking about the, you know, the commercial insurance or the private insurance, that you can select any professional that you want and you do not need referrals. Remember, for the prime, you need not technical referrals, but you have to request that service. Because remember, this TRICARE Prime, which is for the active duty and their families, is like an HMO. They have certain limitations. So that's basically the different types of plan that TRICARE has. This is TRICARE Select. Now, it says right there, it is a program for the families of active duty and retired military members. So we're not talking about the active duty personnel. The active duty are the people who are the sponsors, the policy holders, let's put it that way. They have to use TRICARE Prime. They do not qualify for this. It's not for them. Because they have their HMO directly. They are in active duty, so they're going to be part of the Prime TRICARE. So when we hear Prime, we think that this is a top notch. No, it's not. It's an HMO. It is controlled. It is limited. So that's basically what it is. TRICARE Select, on the other hand, this will be a fee for service. It's not an HMO. It's not like a prepaid charge. This fixed rate, this not actually a capitation, but it's almost like it. For the Select, no. If the doctor charges $200 per visit, that's what TRICARE Select is going to reimburse that doctor. But if you are in an active duty, then remember, you are the member who's serving at that particular moment, the country. So you don't have to be paying a lot for the services. You're going to be paying a lot less because that's the purpose. If you're an active duty, you might think, well, you should get the best of all of them. No, because here, you see, you might have to come out with some money from your pocket. So that's basically. Not much, but you might have to pay. So remember, TRICARE Prime, they don't pay anything. They don't pay co-insurance. They don't pay the deductible. They don't pay co-payment. There is none of those things. Now, with TRICARE Select, you have to pay a co-payment. So that's basically what it is. So you have to pay deductible. Yeah, you have in a more kind of selected, that's what it's called, select. You select your services, but then you're gonna pay more. And this is for family and retired members of the military. So that's basically what it is. So if your family member wants to go to this particular doctor, no problem. TRICARE Select is gonna pay whatever they pay, and anything else is going to be your responsibility because you're selecting them. Particularly, that's the reason why. Remember, TRICARE Select is not for the active duty, is for the families of the active duty and the families of the retired. So that's how it works. Now, if you go outside of the network, now, once again, these visits or these services needs to be paid in full. By who? By the members, whoever is using those services. So you have to be within the network. Other than that, it is your responsibility to pay for all those services. That's how it works. The third one, TRICARE for Life. Now, think about this. Now we're gonna talk about Medicare as well. Because this is for individuals that are, already above 65 years of age. Because remember, whenever we talk about Medicare, we immediately think 65 or older. So that's how it works. So TRICARE for Life is a program for beneficiaries who are both Medicare and TRICARE eligible. Now, once again, you have to be in the military. So that's basically what it is. Now, because Medicare is a governmental funded insurance, then they're gonna pay to the military who are individuals of age of 65 and over. And now, receive benefits from Medicare plus TRICARE. See, when we are in the civilian world, when you will be turning 65, you can get Medicare, right? You qualify for it. But also you can get Medicaid. Well, here, Medicaid do not participate. It will be Medicare because you already work. You pay already your dues, your fees. Your obligations were met during the time that you were working. So now you have Medicare, and now you have also the service of TRICARE because now you are a retiree. So that's how it works. Now, which parts of Medicare these TRICARE for Life members will be qualifying for? Easy. Part A and Part B. Remember, Part A is for hospitalizations. Just think about this. After 65, more than 80% of the population, if I'm not wrong, at least, have a pre-existing medical condition that has to be treated, and somehow they're gonna end up in the hospital, being treated, staying there. And of course, you need the plan B because you need the outpatient services. Whether you have or you don't have a pre-existing condition, well, we get these regular checkups, right? Examinations, any little issue that might arise during our lifetime, so they can go there and receive those services. That's exactly how it works. So the claim will be submitted to the primary insurance first, which is TRICARE, not to Medicare. So if you have TRICARE for life and Medicare, we will be the primary insurance, TRICARE. Oh, I'm sorry, my bad. Medicare will be the primary, and TRICARE for life will be the secondary pay. Remember, after 65, Medicare is the primary. If you have Medicare, Medicaid, Medicare is the primary. Medicare will be the secondary. If you have TRICARE for life because you are over 65, Medicare takes over again, and it will be the primary, and TRICARE for life will be the secondary. So in this case, TRICARE for life would be like Medicaid. It's not, but it's an example because it will be taking the second place, like Medicaid will be the secondary if you have Medicare. So TRICARE for life will be secondary. So that's how it works. Any questions about TRICARE? Because that is it with TRICARE. Remember, TRICARE is for active duty, family members, veterans, retirees, family members. Now we're going to talk about CHAMBA. That will be another group of personnel who were in the military, but under certain circumstances, they qualify for a different insurance. Because remember, these are for veterans, someone who were in the war, someone who fought, for our country, were disabled, can't come and work anymore for any reason. So that's basically how it works. Now, CHAMBA, this definitely is an acronym. And you see how long it is? Who's going to remember all that? I don't. But I do remember CHAMBA. I do remember TRICARE. And when you used to TRICARE with shampoos, I will remember that. But who's going to remember the civilian health and medical program of the Department of Veterans Affairs? I'm not going to remember any of those. I'm going to remember Veterans Affairs because it's the VA at the end. That's it. Anything else, it will be very difficult to remember this long word. For that reason, we use, these acronyms. So whenever you see this acronym like CHAMBA, TRICARE, immediately just think about insurances that covers medical person. That's military person. So that's basically what it is. So it says right there, who is covered under the CHAMBA? Now, it says that covers families of veterans and the surviving spouses and children of veterans who meet certain services connected to disability. So let's say that you work for a certain period of time, you're a veteran, you got injured where you were in this particular service, or you just service during times of war, then you will qualify. So do not confuse these veterans with the retirees, because a retired person can be a veteran, but not a veteran can be a retiree. That's not the way it works, because veterans can just work for a period of time. Retirees is like for the entire life. They have to meet certain criteria. In the military, or in the government, you have to work at least for a period of 20 years. After 20 years, you can retire. So that's basically what. So now you will be a retiree and you will be a veteran. But not every single veteran is a retiree, because not every single person that, fought in the war, were there for 20 years. They were there for certain years, and that's it. They were discharged, whether with disability, whether the war ends. So that's it. They return home, and that is it. They don't go back to the military. They don't continue in the services. So they retire at that time. They just met some time of, the enrollment was, or the enlistment was for this particular time. So that's basically what it is. So who pays for them? Well, the Department of Veterans Affairs and the Department of Defense. So that's basically what it is. So they're going to be responsible for all these services. So for this type of patients, you have to do whatever we do with all the insurances in regular situations when the patient comes for a visit. You have to, review or to check that insurance card from the particular patient, because we're gonna make sure that this person is a participant of CHOPNA, not TRICARE. Because remember, TRICARE works differently, pays differently, and if you send this TRICARE, this CHOPNA card as a primary for services to be reimbursed to the medical doctors, whereas it was supposed to be TRICARE, then the insurance is not going to pay. Because you're making mistakes. It's like sending Medicare as a primary when actually was Medicare. Or any other insurance was the primary, and you just mix them up. So here we have to check verification. You have to verify, and if there is an authorization or pre-authorization, you need to get it. Because for certain services, you have to be, authorized to receive those services. And we're going to do exactly like we do with the civilians, with private or any other medical insurance for civilians. Remember, now we're talking about the military. So in order to differentiate between, the employees on the outside of the military, well, we're going to talk about the private insurances. We're going to talk about Medicare, Medicaid. But here is the military. So we're going to use different terms. So that's basically how it works. So we have to all the time verify, because it is needed. If the services are not covered, or the services are not necessary, then medically necessary, then those are not going to be covered. Remember, this is the same, type of organization when it comes to Medicare and Medicaid. You have to be pre-approved. This is the, taxpayers' money. So we always use the term, this is the government money, just because the government controls the money from the taxpayers. So they need to keep an eye on that to make sure that all these funds are used, correctly, that there is no waste of money or funds. So that is basically how it works. So it says right there, CHAMBA is usually the secondary pay. just like TRICARE when you have Medicare or when you have another insurance. So someone else is going to pay for the first part, which is TRICARE. And then Chamba is going to pay for the balance. But if you only have Chamba, well, then that's going to be the primary. It's like if you only have Medicaid, that's the one that's going to pay. So that is basically how it is. So just keep in mind these big names right there, like TRICARE and Chamba, because that is basically what you need to understand, that this is for, military personnel, veterans, and their families. And when we talk about families, we talk about anyone who is a dependent, whether the sponsor or the policyholder has passed away, the family still keep the benefits until they die. So that's how it works. So keep it in mind. So Chamba doesn't have plans. It is just Chamba. Remember, TRICARE has TRICARE Prime, TRICARE Select, and TRICARE for Life. Now, Chamba is just that, and Chamba for Life. So what is exactly the services that covers and who's covered? So these services or these benefits are extended to the spouse or dependents who are age 65 and over. So that's basically what it is. Very similar to the TRICARE for Life. Has to do with, someone who has 65 years of age or over. The same that happens with the TRICARE, you're going to be enrolled with Medicare Part A and Part B. So Chamba for Life, TRICARE for Life, same thing. No difference. It's just done because who is receiving the benefits through which insurance plan they are receiving the benefits. That's the only thing that they change. Because remember, TRICARE for active duty and their families. Chamba for veterans. Most likely for those who, are disabled. Disabled can be physically disabled or it can be mentally disabled. Someone who has gone through all these troubles, fighting during a wartime, they're going to develop a lot of, mental, psychological, and of course, physical disabilities. So they and their families will be covered. So that's basically what it is. So we don't have many other options like that. Filing a claim. So we went through filing a claim for the civilian insurances, remember? Any of those private insurance, employer sponsored insurance. How do we file claims for these military? How do medical services get reimbursed from military personnel? So the participating providers files claims on behalf of the patients. So that's basically how they do. That's how we do in the civilian world. It's not the patient who files the claim to reimburse the medical doctor. No, it's the participating providers. No difference. They just do it the same with a little caveat. So that's basically what it is. But it's done based on where the clients or the sponsor of the patients is located, because it's our regional level. Say if you're living in New York, well, it goes to New York regardless. Here is depends on what base these military personnel are located, or where these veterans are living in. Where are they? Because veterans can move anywhere, and the military personnel can be, deployed anywhere in the world. And they have coverage and insurance, whether they are in Italy, whether they're in Afghanistan, or whether they are here in the United States. Wherever this military personnel has been deployed or they are stationary, they have that area where, that regional area where they providers are going to be filing the claims, even though if someone from America is going to be paying them. Because remember, if we are civilians, we're just going to be within that state. But for the military, because they are not in one place, they are in, a variety of places, even overseas, remember. So that's basically how it works. So the participating provider is going to file the claims on behalf of the patient. Now, individuals file their own claims for services from non-participating providers. See, that's a different issue. If you receive services from a participating provider, then your participating provider is going to, complete that claim. But if you're not, now you as an individual, you have to do it. Now you are responsible. And whatever, these non-participating provider charge you, you might have to come out with the balance if TRICARE or CHOPNA does not, pay the full amount that, the non-participating provider is requesting for, or it is claiming for. So that's basically what it is. They have different regions. In this case, they have, the two national administration regions for TRICARE are TRICARE East and TRICARE West. Well, I'm not with the military people, so I'm not familiar with those things. But they have different regions where, these claims are going to be sent to. That's basically what it is. See, if we are in New York and you have, Oxford or United Healthcare or Cigna or Medicaid or Medicare, you're going to send it particularly to that particular medical provider. Here, you send it to this regional administration office. Wherever you are going to be assigned these particular, regions where you're supposed to be sending those claims. I'm not gonna go over who is, in the TRICARE East or the TRICARE West, because I don't even know what is that, but it's not something that we needed. Now there is a third region, but that's going to cover international claims. I was wondering about that. So that's how it works. Because remember, we have, plenty, lots of personnel working overseas, protecting our country or protecting other countries, you know, from overseas, representing the United States. So these people is going to be paid for certain, these regions are going to be responsible for reimbursing these medical providers for the services provided to the military personnel. Depends on, which region they belong to. So that's basically what it is. So it's going to be a little different. It's going to be a different type of billing training, I believe, because this is something that goes a little beyond what is regular billing cycles for the claims. So that's something that we have to take into consideration. Well, here we go again, HIPAA. Remember, as long as the patient's or the protected health information is involved, well, HIPAA is going to be there. Why are you thinking that, because they are the military personnel, we don't have to keep their information, the private or identifiable information private? Yes, of course we have to keep it private, confidential, and secure. Very important. So the military health and systems, remember MHS, and the TRICARE plans are required to comply with HIPAA. Not only those, anyone who holds or collects or captures information from the patients needs to be abide by HIPAA. Remember, HIPAA stands for Health Information Portability and Accountability Act. Oh, Health Insurance Information. Health Insurance Portability and Accountability Act. So health, because it protects, and protects the information that is collected for these purposes. Insurance, because it's going to be shared with the insurance company. Portability, because remember, when someone loses their job or quits their job, you're going to be able to continue with your coverage or your insurance until you find another job or you join some other, services to keep you covered. Accountability, remember, anybody is responsible. Whoever have, a contact, interaction with this information, you're accountable. Meaning you're responsible, you are liable. So you're going to be found guilty of disclosing the patient's information, regardless whether you're a military or whether you're a civilian. So here we are going to use the same regulations for all the information that is transmitted, whether in paper, whether electronically, anyhow. We have to. There is a notice of privacy practice. Remember, this is something that we tell the patient all the time. During the time of the registration of the patient, we have to tell the patient how the patient information is going to be used. Who is going to receive the information? To whom are we going to disclose part of your information and for what reason? So it doesn't change whether you are a military personnel or whether you are a civilian. Because we're not going to talk about just employees, because not everybody's an employee. Civilians, just us, regular people. The military is in a different category. They are rendering services to protect the country, to protect us. So that's something that needs to be taken in consideration. So remember, HIPAA is going to be all the time. In your national certification, you must know HIPAA. And that's what we go over and over and over. You must know OSHA. You have to, safety in your workplace. What should you do? What should not do? How you're going to protect yourself from getting, some infections, some diseases, and how you're going to protect your patients for not passing them, not becoming them sicker, or giving them something that they didn't have when they came to our office. Law and ethics. Remember, we need to know, we have to keep, some ethical, policies to protect our patients as well. Not to get ourselves in trouble, to do the things that we're supposed to do correctly. Believe it or not, just because this is the government insurance does not imply that it's exempt of any fraud or abuse. Remember, government money, well, been telling you all this time, this is no government money, this is the taxpayers. The people, this is not their money, they're going to take it, right? They're going to use it and abuse it. So that's basically what it is. So fraud and abuse all over the place. Where is money, there's going to be fraud, and it's going to be abuse. When it's power, it's going to be fraud, it's going to be abuse. So we have different entities, they are monitoring what's going on, not just here within, the country, the territory of the US, but overseas as well. We don't need to get involved in all these organizations that deals with, keeping an eye on how this money is distributed, how this money is used to pay for the services of all the military personnel that is currently, enlisted, or those who no longer are in the service, but nonetheless, they are receiving services as well. So fraud, there's always going to be fraud when there's money. And whoever gets caught, they're going to pay the consequences. So that it can be just the civilian world. They can be excluded from rendering services. They can be, in other words, they will no longer be participants of TRICARE or CHAPNA. They can be penalized, monetary, charges for violation of HIPAA, whichever the case, whichever rule you violated. And it can be civil or criminal penalties. Remember, it can be, charged with felony. Usually it's a felony. Fraud is a felony. It's not a misdemeanor, it's a felony. It is a serious crime. We gotta make sure that we understand how this works. Okay, so how these Chamba claims are filed. You're gonna follow again HIPAA regulations. So most of these claims, once again, for participating providers are gonna be filed by, the provider. That's basically what it is. Then they're gonna be submitted to this organization, this insurance, which is Chamba, for processing. Now, follows the same process for filing a claim as TRICARE. There's no difference. Remember that the only difference between TRICARE and Chamba is, who is the beneficiary, who participates. Anything else is almost the same. TRICARE has, different plans. It has 3 different plans, whereas Chamba has only 2 plans, just regular Chamba and Chamba for life. TRICARE has TRICARE Prime, TRICARE Select, and TRICARE for life. So that's basically what you need to understand from this chapter. It's not much the information. I don't want to, overload you with all this information because TRICARE and Chamba are not something that you're gonna encounter in your workplace. Sometimes just for questions on your test, we kind of spend a little more time with this chapter, but other than that, you might not encounter this. Because remember, they have their own, institutions with military personnel are, treated, taken care of. It's not these private regular, hospitals. So for that reason, we don't build this much. People who learn billing and coding, they usually do it with the purpose of billing for, civilians, not for these military. Of course, they're going to have someone who bills for those, but those are a little different the way that we file claims for these regular other insurance companies. That's basically what it is. Okay, any questions? Wow, we didn't even reach 2 hours with this chapter. But that's all we're gonna cover today. We're done for today. Tomorrow we have another chapter, and that is it. We're gonna be done. The module will be over, and I will send you the exam for this one on Tuesday, on Wednesday, and you will go on vacation for, these all festivities. Vacation. You will have to come back like January 2nd, I believe. Then we'll be talking about another chapter, which is laboratory procedures. I believe that's the one that I have on this. And then we're going to talk about pharmacology, and then, whatever else comes after. So that's how it is. We're going to leave it here. I'm not going to give you more information because it's too much information for, this military insurance. Everything else we have covered, most of the stuff that you will need for this course, and that's basically what it is. Do you guys have any questions? Remember, we're gonna be done for today. We just finished this chapter, and tomorrow we're gonna finish another one. I told this was going to be a lot of information, but it wasn't, because most of the stuff is like, already being covered. It overlaps lots of information that we have covered in other chapters. This is just the only difference is, that this is for medical personnel. And we're not going to talk about again how to file a claim because we have already a chapter for that. So that's basically what it is. Okay, so before I let you go, let me know if you have any questions, please.
Yes, out of curiosity, how many hours are we into the course already?
For this module,
No, just in general.
in general, for is 900 hours for the entire program, including internship that is like 3 months of internship.
Okay.
So the total amount for the medical assistant is going to be 900 hours.
So how many hours since the beginning of the course have we completed so far?
Well, each of you have a different starting point.
Okay.
So
That makes
that
sense.
needs to be discussed with the director. I believe you can contact Gina,
Okay.
and she will tell you, okay, mostly go by modules. It's a lot easier. I don't know if you have um the the schedule for the program. I don't know if you receive it.
Yes.
So yeah,
Mm-hmm.
so check the schedule and follow the modules. It's a lot easier that way. So you check, oh, I did this module. This module is 30 hours. This module is 60 hours. This module is this or that. So that's basically what it is.
Okay. All right. Thank
Yeah,
you.
no problem. Any other questions? And it's just for this chapter that we are kind of, short on some information because it's not much information from medical insurance because we're not doing the codification. If we're doing the coding, then it's different, but we're not doing the coding. So for that reason, this couple of chapters are, the last two chapters have been a little shorter the class, but next chapters we're gonna be like the other ones, right on point. Gonna be the whole 4 hours right here talking about the subjects, but these ones, and there's something else, but I don't want to give you that because that is just too much material for you guys. It won't be to your benefit, so just giving you information that you're not going to be using is not worth. So my advice to you is just review the material, prepare for the exam, because on Wednesday I'm gonna be sending you the final exam for this course, and that is it. It will be done. Once again, we're gonna go on vacation, and then when we come back on January, we're gonna have laboratory procedures. That's gonna be a long, long, long chapter. So long modules. So we're gonna stay time, and then pharmacology is gonna be long too. So take advantage now because we're gonna go easy on those two chapters now, and before you hit your festivities, your holidays. So we're gonna go easy on you at this time. Okay. So any other questions?